Welcome to C2, Counseling Procedures and Strategies. Before beginning this lesson, make sure you download and review the reference materials outlined in the C2 Course Materials section. This teaching lesson will help connect the major concepts from your readings to the work of a Chemical Dependency Counselor Assistant, or CDCA. This lesson does not replace your assigned readings. Use both the course materials and this lesson to prepare for your knowledge check. Let's get started. Counseling procedures and strategies are the methods professionals use to support clients throughout the treatment and recovery process. As a CDCA, your role is to provide counseling services under appropriate supervision, support treatment goals, observe client behavior, and use professional counseling techniques within your scope of practice. An important counseling skill is listening. Listening involves more than simply hearing a client's words. One technique commonly used in counseling is reflective listening. Reflective listening means restating or paraphrasing what the client has said in a way that demonstrates understanding and encourages further discussion. For example, a client may say, "Everybody keeps telling me I need to change, but I am not sure I even have a problem." A reflective response might be, "You are hearing a lot of concern from other people, but you are still trying to decide how you feel about your substance use." The counselor is not arguing. The counselor is not telling the client what to think. Instead, the counselor is showing that they are listening and encouraging the client to continue exploring the issue. This skill is especially important in motivational interviewing. Motivational interviewing is a collaborative counseling style designed to strengthen a person's own motivation and commitment to change. The counselor does not take the position of saying, "I know what is best for you." The counselor also avoids threats, judgment, and unnecessary confrontation. Instead, the counselor uses strategies that encourage clients to talk about their own reasons for change. Open-ended questions can support this process. An open-ended question usually cannot be answered with a simple yes or no. For example, asking, "What are some reasons you have considered making a change?" gives the client an opportunity to explore their thoughts and motivation. This is different from saying, "You need to stop using immediately." The goal is to help the client identify personal reasons for change. Counselors may also listen for what is called change talk. Change talk includes statements from the client that suggest a desire, ability, reason, need, or commitment to change. A client may say, "I am tired of missing work." Another client may say, "I think my drinking is affecting my family." These statements provide important opportunities for further discussion. The counselor can use reflective listening and open-ended questions to help the client explore these concerns. Motivation for change can also be understood through the stages of change model. People do not always move from substance use directly into action. Change is often a process. In pre-contemplation, a person may not recognize a problem or may not be considering change. In contemplation, the person recognizes that there may be a problem but has not yet committed to taking action. In preparation, the person begins planning for change. In action, the person is actively making changes. Maintenance involves continuing those changes and working to prevent a return to previous behaviors. It is important for counselors to consider the client's stage of change. A counseling strategy that may be appropriate for someone ready to take action may not be effective for a person who is still questioning whether a problem exists. The counselor should meet the client where they are and use strategies that support movement toward change. Now, let's discuss cognitive behavioral therapy, often called CBT. CBT focuses on the relationship between thoughts, feelings, and behaviors. These areas can influence one another. For example, a person may have the thought, "I cannot handle stress without using." That thought may contribute to feelings of anxiety or hopelessness. Those feelings may then increase the urge to use substances. CBT strategies help clients identify unhelpful thoughts and behaviors and develop healthier ways of responding. The counselor may help the client examine a thought, consider whether it is accurate or helpful, and identify another way to respond. The goal is not simply positive thinking. The goal is to help clients recognize patterns and develop more effective coping strategies. Counselors may also work with clients who have substance use concerns along with mental health symptoms. This is often referred to as a co-occurring disorder. For example, a client may show signs of depression while also receiving substance use disorder services. A CDCA should not ignore mental health symptoms. At the same time, the counselor should not independently diagnose a mental health disorder outside of their scope of practice. The appropriate response is to recognize the concern, document relevant observations, seek supervision, and refer the client for further assessment when appropriate. This supports continuity of care and helps ensure that the client's needs are addressed. Another important part of counseling is understanding the professional relationship between the counselor and the client. Transference occurs when a client directs feelings or expectations connected to another important person toward the counselor. For example, a client may respond to a counselor as though the counselor is a critical parent or another authority figure from the client's past. The client's reaction may be influenced by previous relationships and experiences. Countertransference involves the counselor's emotional reactions to the client. These reactions may be influenced by the counselor's own personal history, experiences, or unresolved concerns. For example, a counselor may feel unusually protective, frustrated, or emotionally connected to a particular client. Having an emotional reaction does not automatically mean the counselor has acted unethically. The important issue is recognizing the reaction and making sure it does not interfere with professional judgment or the client's treatment. This is another reason supervision is important. Counselors should be willing to discuss strong emotional reactions with an appropriate supervisor and maintain professional boundaries. Finally, let's discuss harm reduction. Harm reduction is an approach that focuses on reducing the negative consequences associated with substance use. It does not mean ignoring substance use. It also does not mean that treatment professionals have no goals for change. Instead, harm reduction recognizes that clients may be at different stages of readiness and may have different treatment goals. Strategies may focus on reducing immediate risks, improving safety, increasing access to services, and supporting movement toward healthier choices. Abstinence may be a goal for some clients, but a harm reduction approach does not require every client to begin treatment at the same point. The counselor continues to engage the client and support steps that reduce harm and improve health and safety. Before completing your C2 knowledge check, let's review the major concepts. CDCA professionals provide supervised counseling services and support treatment goals within their scope of practice. Reflective listening involves restating or paraphrasing a client's message to demonstrate understanding and encourage further discussion. Motivational interviewing supports client autonomy and helps clients explore their own reasons for change. Open-ended questions encourage discussion. Change talk includes client statements that support or consider change. The stages of change model recognizes that people move through different levels of readiness. CBT focuses on the interaction between thoughts, feelings, and behaviors. Potential co-occurring mental health concerns should be recognized and referred for further assessment when appropriate. Transference involves client feelings or expectations being directed toward the counselor. Countertransference involves the counselor's emotional reactions to the client. And harm reduction focuses on reducing negative consequences and supporting safer, healthier choices. Take time to review the reference materials outlined in the C2 course materials section before completing your knowledge check. This concludes C2, Counseling Procedures and Strategies.